So one of the first things I'm going to start out in talking about traceability for us is that we kind of have a different perspective than some of the discussions that have been earlier, because Florida is the original and probably the most extreme sunshine state that there is. And as a result of that, we have chosen to almost exclusively utilize federal databases because that's more secure than anything would be if it was in our hands. So one of the things we do is utilize a lot of federal databases, and that, when it comes down to it, ends up also being one of the issues is we use a lot of federal databases. So so I'm thrilled by the discussion that happened this morning with both Jack Shearer and IBOC, because until we get some better interfaces going on with our data management, and until we get recognized the need for a modernization of the IT that is within the federal systems, we're stuck with what we have. So we have done a lot of things to try and work with our industry and to work with, certainly with our veterinarians, to enable that electronic transmission that Dr. Rohr was talking about, to make it where that data is moving in electronically. It's not that it's a scan of somebody's document, that we are actually getting numbers that are moving electronically, and means by which we can do a lot of bulk entry of test information, because that's one of the main sightings we're going to get of official identification. In addition, something that Florida does have is we have a Florida cattle identification rule. It only applies to cattle that are over 18 months of age, and it has exceptions, and I can tell you that the biggest problem with any rule is whenever it has exceptions. But those exceptions are similar to the exceptions in the federal rule. It is direct to slaughter or moving to an approved tagging site. But also if it's moving from one premises to another premises, same ownership and no commingling. And so those really are the exceptions, and it is strictly for cattle that are over 18 months of age. In addition to that, though, when cattle do arrive at a livestock market, there's actually two options of how cattle are moved within the state, and that is, and this is up to the livestock market to choose which of these options. And so there's a set of livestock markets that do choose to make sure that everything's officially identified prior to the sale, and so if they arrive and they are not officially identified, then that livestock market, acting as an approved tagging site, identifies those cattle, and then they go into the sale. The other option is one that requires a livestock market to notify us of any unidentified cattle that were sold through the market and left there unidentified, and it then leaves it up to that purchaser to, within 7 days, officially identify and submit paperwork saying that they've officially identified those animals. Anybody who's a state animal health official can already figure out what the problem is with that. So when we get into ADT and really what we as state animal health officials on a daily basis have to deal with, and the epidemiology and the traces, what we rely on and how it impacts us every day. My most recent probably example is that everybody's already heard, I'm sure, in August of 2018 we were notified that we had a non-negative BSE sample. The luck of the draw was that we eventually found out it was confirmed as being an H-type atypical, but at the moment that you get the first news that you have a non-negative BSE, you don't know that yet, and so the first thing that happens is obviously you want to do some immediate investigation, and so then we get the news that tells us quite immediately that it's going to be a little more complicated because the index premises is a backgrounder of cull cows, and the animal is identified with a noose tag. So now what what goes on regarding all of that? Well, in our state, under that rule, the Florida livestock markets do not have to capture ID unless they actually are applying it as an approved tagging site or if the animal is moving interstate. So it's unlikely that there's going to be any records that way, that as far as capturing things is the first thought. And then we all realize that I think it's been said when they really look at it, 1 in 6 news tags are either read wrong, data entered wrong, or are deemed to be unreadable. So that's how the luck of the draw. But we do not want to give up. We do have for years, and we all know that eventually we will get back to it. It just takes a lot more time when you're dealt these sort of things. So it's been a much more difficult situation because it is a news tag, but we're getting there. In fact, it looks like we have been able to identify that premise of origin, but it's taken too long to do so. When it takes more time, what is the impact of that? For some diseases, it may not be that there's a lot of impact. In the case of this disease, I don't think that we've seen a substantial impact from that. But I can think of several other diseases that the fact that it takes time to make that identification, that you can't immediately get back to that premise of origin, could have significant impacts. In our state, it could easily shut down a state that's, we're a nice little peninsula out there that everybody would kind of like to float off anyway sometimes, and that would just give them more of an excuse to do so. So when it does work, what does make it work? What we have found is a tremendous benefit is any time that there are electronic documents. Complete documentation, of course, is the key. That doesn't matter if it's electronic or manual, but certainly electronic documentation is significant. And if no other reason than the fact that it tends to be much more legible than some of the paper documents are. And so even more key to that can be the fact that you get electronic capture of the ID that really even saves one more step as far as that data entry and transcription errors. So the other thing we have found in our state historically is that tracing is much better when you have one of those option 1 markets. That means that everything that went through the market was identified. That really does make a difference. And even more difference is made when they do happen to be one who does some correlation and actually puts that back tag number and that official identification on a document so that you actually have something to correlate with. Again, everybody, I think, every state animal health official probably has one of these examples that they can talk about. And so in our case, we had within 9 months of each other, we had these 2 different contrasting events of TB traces in dairy cattle. Everybody we get lots of these TB traces in dairy cattle. Very similar amounts of animals that were moved in each case. Both of them have 4 units that were on 4 separate premises, and within each of them within about a 3-county area. Both of them have several thousand animals, but in one case they have no management records. They could not even tell, of those 125 animals that arrived, they could not tell us which of the 4 units they had originally gone to, let alone which one were they currently at this point. And they had nothing that correlated any identification of their flap tags to the official identification that was on what paperwork we received. And the other dairy is a dairy that immediately whenever they arrive, any animal arrives, they apply electronic identification. They maintain very good electronic records, and they can not only tell us what unit they're currently in, but every unit that they've been in, which animals went to slaughter, on what date they went to slaughter, and what processing plant they went to. And so as a result of that, we spent 4 days in the herd total, that we were there for part of 4 days in the herd with electronic records, because within 6 hours we were able to identify where all the cattle were and confirm with each of the plants that they had received the animals that had been sent to them that were no longer in herds. And so we had to go there for that original visit, and then the 2 caudal fold tests, and then the comparative cervical testing, and we were done and out. It was no disruption to the milk line because they used an electronic system that meant they electronically could gate those cattle out and have them penned for us, and we didn't disturb anything. In the cattle herd that had no records at all, it took us 45 days of being within the herd of 12 to 14-hour days. Each day that we were there, it decreased their milk production by 25 to 30%. The cattle were each had to be caught on multiple occasions to go through this. We found that most of the cattle had a minimum of 2 noose tags. Some of them had up to 5 noose tags in them, none of which had been correlated between each other, and none were correlated to any management tags. So what is it that we as state animal health officials need? We need industry support. Not sure what the wake-up call, what it's going to take, but we really do need industry to be behind this. If you want for us to be able to do our job, we need to get the industry support behind us. It's more than just getting a tag in a cow. The sharing between the databases is going to be a critical part of this, and that's why I was so happy to hear what Dr. Shearer had to say. We need improvements, and that's been a lot of the discussion, and that's the benefit of these kind of meetings, is ability to understand and share technology and get ways to capture this information and share it with us so that we have it available when we do need to go out and do actually one of the traces.